So hello friends, welcome back to my channel, and today we will be discussing on the topic permanent maxillary canine. But before starting, only for maxillary canines, let's just see the features and all the functions about the canines, the tooth canine. Okay, so first let's see the position of the canine. What is the numbering system for canines? I had taught to we will just see for the universal numbering system, but I have made a series on that numbering system. If you haven't watched it, do watch it in the playlist. So let's just see for canines. Okay, so where are canines present in the arc? So the numbering system for canines is this. So it is in the right quadrant. Okay, so in the right quadrant, in the maxillary, so this is the right maxillary canine. Okay, similarly this. So people who know the numbering system can understand this. Okay, so let's just see the features. So first, what are the different names of this? So these canines are also called as cuspids or eye teeth or corner teeth, beauty teeth, cornerstone of the dental arch. Okay, so these are few names of canines. Now they are two in number in the maxillary arch as well as in the mandibular arch. Canines often are the last teeth to fall. Okay, and they canines have long and thick roots. So did you know that canines have the maxillary canines have the longest root? They have the longest root than any other tooth in the dental arch. So they are distal to the lateral incisors, and they are the third from the midline. Okay, the third from the midline. So as you number, so 8, 7 and then 6, it's the third teeth, like that. And canines are the only teeth with a labial ridge. We will discuss about this, don't worry, just in a second. First, let's just see the functions. What are the functions of canines? So the canines, there are 5 functions, main functions. First, they assist. Okay, they assist the permanent incisors and premolars in mastication. Okay, so they assist the those teeth, and the main use is tearing the food. What is the main function? They help in tearing the food. Then another function is in phonetics, the pronunciation. Okay, they help in the phonetics. Now also one major role of this teeth is the support. What can they support? They support the lips and the facial muscles. And one last function is they anchor. What do they anchor? So basically, when the tooth is lost, due to decay or something, when the tooth is lost and we need a replacement for that teeth, so we put partial removable dentures or the dental bridges, that is. So those dentures can be uh, you know they can be supported or anchored. They help, these canines help and support those dentures, okay, from falling. They prevent from falling. So this is one of the function. Now what is the chronology of this tooth? So first, evidence of calcification happens from 4 to 5 months. Then enamel completed from 6 to 7 years. Then eruption happens from 11 to 12 years. This is for maxillary canine. Okay, I will tell you for the mandibular canine in a separate video. And the root is completed by 13 to 15 years. Okay, so this was the chronology for the permanent maxillary canine. Also, I will just tell you one separate this one. Just want to let you know what is a canine eminence. This is important and we need to know this. So what is a canine eminence? So it is a vertical ridge or prominence which provides support for facial skeleton and musculation. So basically it supports the facial, it gives this facial you can say the skeleton, it supports it. Okay, it gives a shape to the face, like it is present on the surface of the superior maxillary bone. So it is actually, this canine eminence is present in the maxillary bone, and it is caused due to the socket of the canine tooth. So basically there are sockets, right? Supposing this is my maxillary bone and here is my canine present. So inside over here in the maxillary, so they have alveolar processes, right? So these sockets, this forms the, what does it form? The canine eminence. Alright, so this was something about the canines. Now we will be discussing about the major anatomical landmarks of this tooth, and we will also be discussing each aspect of the maxillary canine in a separate video. Okay, thank you guys.